And we now yield 5 minutes to Mr. Lloyd Smucker of Pennsylvania.
Thank you, Chairman. Thank you for holding this hearing. Thank you for the witnesses for being here. Ms. Bombray-Graves, appreciate you sharing your story. I can tell you, at least for myself, and I think every member here, we want to ensure that you have access to the medical care that you need at a price that you can afford, and that you can have the security of having insurance available to you at a price that you can afford as well. And I've been hearing from so many in my district who are in a similar situation, who have been on the marketplace, Obamacare marketplace, for multiple years and have seen dramatic increases in the premiums in those plans over those years. It's not just this year. And whether the COVID extensions were extended or not, they would have increased even without the extensions. A significant portion of that increase was occurring in the base Obamacare marketplace, which, by the way, regardless of what the ranking member is saying, was designed by Democrats. We have seen dramatic increases in cost, and even the Obamacare subsidies they put in place to expire at the end of the year. But we should get past the politics and think about how we can address your situation and that of so many others across the country as well, who, again, we want to ensure that folks have access to health care and insurance at a price that they can afford. And when you look at not only the increases that we've seen in Obamacare, which have been devastating for you over the years, but we also look at some of the statistics that Mr. Roy and Mr. Polito brought up. I mean, it just isn't working. We are paying much more, families are paying more, and the government is paying more for health care than many other countries across similar countries, as Mr. Roy pointed out, and yet we're sicker than many other nations. So something isn't working. And we should come together rather than blaming one another and try to figure this out. And I think there are some great ideas out there to address your situation, many others across my district that are in the same situation. I guess maybe, Mr. Roy, I'll, let's see, where's the clock? I've just a few minutes here, you know, how would you respond to the discussion that we've just heard? How would you respond to Ms. Bombray-Graves? What can we do? I believe in the free market. I believe that when someone else is paying the bill, you mentioned that 50% of the government, 50% is paid by the government. When there's less competition, that drives up costs. We see it in other areas besides healthcare. But what can we do to bring down the cost of healthcare? What can we do to address the situation that's been talked about here and others in similar situations?
Thank you, Mr. Smucker. It's a delight to be able to respond to these points. First of all, there's been a lot of talk of how expensive the Affordable Care Act-based plans are, but not a lot of talk about why the Affordable Care Act plans are so expensive and why we need to preserve in eternity so-called emergency COVID funding to paper over the dramatic increases in the prices of ACA-based plans. And to respond to Mr. Boyle, who says that there's no Republican ideas about how to improve health care, I refer you to a bill Mr. Smucker co-sponsored called the Fair Care Act, which contains a broad, both Democratic and Republican-based system of how he did not pay me to say this. I did provide technical advice on the bill, so I know it intimately. But I'd encourage you to take a look at it because it would do a lot of the things to correct the design. I worked for Mitt Romney, so I'm very familiar with Mitt Romney's healthcare plan. And the design flaws in the ACA, particularly around driving away healthy and young people from the market, are incredibly important to fix. There are ways to fix that in a bipartisan way. I believe in universal coverage through the private insurance system, which is what the Fair Care Act would help achieve. And so I would just say in the time that I have remaining, I think more members of this committee, if they were to review and provide better ideas to improve the Fair Care Act. It could be reintroduced in this Congress and do a lot to address the concerns that Mr. Boyle has raised.